Greetings from Spain. This oral communication presents the main findings of a study conducted in a rural cross-border area of Spain and Portugal about the quality of life of families of people with neurodegenerative diseases and the related factors. It is co-authored by different members of the NEUROQUALYFAM project who work at the University of Salamanca. Neurodegenerative diseases such as Alzheimer's disease, Parkinson's disease, and multiple sclerosis are one of the major causes of disability and dependency among older adults. They have a great impact at the physical, psychological, social, and economic levels, not only on patients, but also on their caregivers, families, and society at large. Given the increased life expectancy and progressive aging of the population, a significant increase in the prevalence figures of cognitive impairment and dementia is expected. Family members provide most of the care to people with dementia. They must provide increasing supervision as the patient becomes more functionally dependent, as well as cope with behavioral disturbances and loss of communication skills, among others. This situation is especially challenging in rural areas, where they feel more isolated and have fewer opportunities to receive professional support. From a family systems perspective, the impact of dementia goes beyond the patient. What affects one member of the family affects the dynamics and normal functioning of the entire family system. However, both research and practice generally adopt an individual or dualistic approach that focuses on the person with dementia and the main caregiver, thus paying less attention to the family unit. Moreover, most studies and intervention initiatives are oriented towards addressing the burden and stress experienced by the family or the caregiver, rather than strengthening the resources and skills they possess, as well as the positive and rewarding dimension of the experience. Hence, the adoption of a systemic approach of family quality of life has the potential for greater clinical and scientific utility than existing individual or reductionist approaches. Likewise, the identification of predictors of family quality of life might help guide more effective social health promotion strategies that increase the quality of life of family caregivers of people with neurodegenerative diseases. For all these reasons, the main aim of this study was to analyze the quality of life of families of people with neurodegenerative diseases living in the rural cross-border region of Spain and Portugal by adopting a systemic and holistic point of view. The specific objectives were to describe family quality of life at the global and domain level in terms of attainment and satisfaction, as well as to identify socio-demographic, family, and social health factors that influence family quality of life. As for the methods, the sample consisted of 300 family members of people with neurodegenerative diseases, the mean age being 62 years. The majority were females, married or with a partner, not working, with low income, and with primary or secondary school qualifications. The vast majority were spouse or partner, or the son or daughter of the patient, and played the role of primary caregiver, with 3 out of 4 living in the same household. Most of them lived in rural areas of up to 10,000 people. As for care recipients, their main age was 79 years, and most were females with dementia or Parkinson's disease, and with some level of dependence, which was generally high or moderate. The instrument used was the Family Quality of Life Survey for caregivers of people with neurodegenerative disease. It was developed from the translation, adaptation, and validation to the Spanish context of the Family Quality of Life Survey for caregivers of persons with dementia, following the International Test Commission guidelines. This tool collected information on how the family perceived its quality of life both globally and in 9 domains, according to 2 dimensions: attainment, or the degree to which the family is able to obtain those things that it wants, and satisfaction, or the overall perception of important aspects of family life. Concretely, the domains of family life assessed were the following: family health, financial well-being, family relationships, support from others, support from services, influence of values, careers and planning for careers, leisure and recreation, and community interaction. All items were rated on a 5-point Likert type scale, with higher scores indicating higher levels. The survey also collected data on the following variables: sociodemographic factors, including gender, age, educational level, employment status, income per month, civil status, whether the family caregiver lives with the patient, and type of relationship between them. Family factors were also measured, including the level of independence in diverse basic and instrumental activities of daily life, and the level of communication skills. And finally, social health factors, including the number of services used by any of the family members and the number of perceived barriers to receive these services. The survey was administered via telephone in about 30 minutes by trained and experienced interviewers to meet the restrictions resulting from the COVID-19 pandemic. Participants were informed about the aim of the study, the anonymity of responses, and their right to drop out at any time. According to descriptive analysis, the average score in the global family quality of life was 3.65 for attainment and 3.69 for satisfaction. By domains, as shown in the table, the highest value was found in family relations and careers, and the lowest in support from services and leisure, both in the attainment and satisfaction dimensions. To identify the predictors of the dependent variables, 20 hierarchical multiple linear regression models were conducted. Medium predictive values were found in financial well-being, support from services, and leisure, and small predictive values were observed in the rest of domains. Exceptionally, values and support from others were not explained by the factors included in the models. Sociodemographic factors were included in the models of the domains health, financial well-being, family relations, and support from services. Family factors were included in the models of the domains leisure and community. Both types of factors were present in the model of the careers domain. It is worth noting, however, that the number of perceived barriers to social health services was present in all the explanatory models in the 2 dimensions, attainment and satisfaction, except for the domains support from others and influence of values. As shown in the figure, the barriers more frequently reported by participants were long wait for service, service is not available in my area, transportation is a problem, do not know where to go, and cannot afford financial costs. Therefore, our findings showed that family caregivers of people with neurodegenerative diseases considered that their family quality of life was good or fair. The ratings obtained were similar to those of past studies among caregivers of individuals with developmental disabilities and dementia. In addition, our findings suggest that family quality of life is determined more by environmental factors than by sociodemographic and family characteristics. Concretely, we found that the number of family perceived barriers to accessing social health services was the strongest predictor. This shows the importance of providing family caregivers with adequate health resources and social service supports according to their needs. For example, increasing primary and specialized care consultation times, creating specific units, providing information about economic resources and benefits, improving their availability of proximity services, and among others. Likewise, better and timely access to appropriate services, reduce waiting time for appointments, and facilitating transport might improve family quality of life among this population. In conclusion, this study highlights the importance of paying attention to family quality of life and the barriers that families encounter to access services, especially in rural areas where the aging of the population increases the incidence of neurodegenerative diseases. Specifically, our results confirm that there is a need to design a specific portfolio of services, resources, and benefits that involves the key sectors of family welfare, that is public, private, third sector, and to bring them closer to these areas, covering all the family needs. Future research should examine other family variables, as well as physical, social, and attitudinal environmental variables. In addition, it should identify not only the negative aspects of the environment, but the positive ones as well. That is not only the barriers, but also the facilitators, which can be enhanced to increase the quality of life of families of people with neurodegenerative diseases who live in the rural cross-border area of Spain and Portugal. Thank you very much for your attention. If you have any question, please do not hesitate to contact us.